All right, let's jump right in. In this explainer, we're going to take a really close look at a medication that's a bit of a multi-tool for some tough neurological issues. Welcome to a clinician's guided tour of Oxcarbazepine. Okay, so let's kick things off with a question. Think about this. What could possibly connect seizures, that awful sharp nerve pain from neuralgia, and even migraines? I mean, they seem pretty different, right? Well, it turns out there's a pharmacological thread that ties them all together. And that thread, the answer we're diving into today, is Oxcarbazepine. Yep, just one medication that can tackle these very different conditions. You can see why it's such a vital tool in a clinician's toolkit. So, first things first, what is Oxcarbazepine, really? And where does it fit into our treatment plans? Let's get into its therapeutic role. Okay, so Oxcarbazepine has a few very specific jobs. It's a real go-to for managing certain kinds of seizures. It can also bring some serious relief for that intense neuralgia pain, and it's even used in treating migraines. Understanding these main uses is really the key to knowing when to reach for it. All right, so we know what it's for, but that's only half the battle, right? The big question is, how do we use it safely and effectively? Let's get into the practical side of things. How to administer it, how to dose it, and basically how to start and manage treatment the right way.
The good news is giving it is pretty straightforward. It comes as either a tablet you swallow or as a liquid. That flexibility is super helpful, you know? You can match the form to what your patient can handle, especially if swallowing pills is an issue.
When it comes to dosing, the mantra is simple. Start low and go slow. Seriously, that's the whole game. You begin with a lower dose and then you bump it up gradually. Why? Because this slow ramp up helps keep those initial side effects to a minimum. And here's another key point. Whatever the total daily dose is, you've got to split it into 2 equal doses. This keeps the drug levels in the body nice and steady.
Okay, pay close attention here because this next part is absolutely critical for keeping your patients safe. We're about to talk about adverse reactions, and we need to be crystal clear on the difference between the common, everyday side effects and the really serious red alert ones you cannot afford to miss.
So you can basically think of the side effects in 2 buckets. In one bucket, you've got the more common stuff. Dizziness, feeling drowsy, maybe some vision changes or a headache. Annoying, but manageable. But in the other bucket, you have the critical, potentially life-threatening reactions. We're talking about things like Stevens-Johnson syndrome. That's a horrific skin reaction. Hypothyroidism, leukopenia, which is a big drop in white blood cells, and hyponatremia, where sodium levels get dangerously low. Knowing which bucket a symptom falls into is just everything for patient safety. So, just knowing about these risks isn't enough, right? We have to do something about it. And that leads us to the single most important takeaway here. Active monitoring is absolutely key. It's the cornerstone of using this drug safely. And this is basically your game plan. Think of it as a simple checklist that connects the dots. Worried about hyponatremia? Well, you've got to be checking those sodium levels. Concerned about leukopenia? Then you need to be monitoring their white blood cell count. It's all about targeted surveillance, not just hoping for the best. Okay, moving on to something just as important. Critical interactions and warnings. This is the stuff you absolutely must know before your patient even takes their first dose.
Before we get into the specifics, let's make sure we're all on the same page with a super important word, contraindication. This isn't just a be careful warning. A contraindication is a hard stop. It means do not pass go, do not give this medication because the potential for harm is just too high.
So, what's the big one for Oxcarbazepine? The number one contraindication is a known allergy to carbamazepine. These 2 drugs are like cousins, structurally speaking, so if a patient reacts to one, they're very likely to react to the other. This is why you have to be so thorough when you're taking that allergy history. You gotta ask.
Now, the interaction with phenytoin is a tricky one. It's like a 2-way street, and the traffic is going in opposite directions. On one hand, Oxcarbazepine can make phenytoin levels go up, which could lead to toxicity. But at the same time, phenytoin can make Oxcarbazepine levels go down, which might mean it stops working as well. So if your patient is on both, you have to be watching them like a hawk.
And here's another really big one that has huge real-world consequences. Oxcarbazepine can actually make oral contraceptives, birth control pills, less effective. This is an absolutely critical piece of information to discuss with your patient. It's a conversation that has a direct impact on family planning. And that's a perfect segue into our final section. What do we need to tell our patients? This is where we take all this clinical knowledge and turn it into simple, clear instructions that empower them to be a part of their own safety team. Okay, there are 2 counseling points that are absolutely non-negotiable. First, you've got to tell them to limit their sun exposure and wear protective clothing. And second, connecting back to what we just said, if they're on oral contraceptives, they must use an additional form of birth control. This is to prevent an unintended pregnancy. You have to be super clear about these points for their safety.
So, we've covered a lot, haven't we? We've looked at what it's for, how to dose it, the whole range of side effects, and the critical instructions for patients. Which brings me to one last question for you to think about. After hearing all of this, what do you think is the single most important conversation you need to have with your patient before they start this medication? Because really, that conversation, that's where safe and effective care truly begins.